So in this video we'll discuss about angina. We're gonna make it simple. Angina. So angina is just a discomfort. It's a condition caused by reduced blood flow in the heart. Condition caused by what? Reduced blood flow in the heart. So now, angina causes discomfort of the chest and chest pains due to lack of what? Oxygen to the myocardial cells. So you're finding to say the cells will be having what? Less oxygen reaching there due to obstructions in the coronary artery, which is the blood supply to the what? To the artery. So now, this pain of angina may be felt in some points where we're having the shoulder, the neck, the jaw, and the back. So the pain of angina can be directed to these parts, which is the shoulder, the neck, the jaw, and the back. So the pathogenesis of angina is that there is imbalance. There is what? Imbalance of the oxygen supply and the oxygen demand. So there is an imbalance between what the oxygen supply and the oxygen demand. So now, the drugs which will be used in angina will be helping in what? Reversing the process of what? Of increasing the oxygen supply. Will be increasing the oxygen supply while reducing the what? The oxygen what? Demand. That's how the drugs will be what? Will be functioning. So there are some activities that really causes increase in what? Oxygen demand. For example, we're having what? Exercise. When a person is exercising, what else? The preload and the afterload. Reason being, this causes what? Increased contractility, where the heart contracts first. That's where in what? You're finding the demand is doing what? Is increasing. Besides that, even in atheroma, even in what? Atheroma. For activities that are reducing, yeah, the activities that are increasing oxygen supply is just diastolic. A diastolic is increasing what? Blood supply. While the athlete is reducing. So yeah, there are some risk factors. There are some risk factors that are associated with angina. So some of the risk factors are that age, smoking, obesity. So these risk factors are the factors that brings about what? Angina, that makes a person prone to what? Angina. Hypertension, high cholesterol levels, inactivity, when you're keeping your body inactive. Yeah. Diabetes. In diabetic patients, they are prone to having what? Angina problems. Yeah. So the symptoms of angina are that there are what? Chest pains which are radiating. Tightening or tightness of the chest. Nausea and vomiting. Dyspnea which is difficult in breathing. One thing to note is that in the treatment of angina, we don't use what? Hydrazine. Hydrazine is not used in the treatment of what? Angina. This drug is not used in the treatment of what? Angina. It cannot be used in the treatment of angina. So now the drugs used in the treatment of angina are abbreviated in the mnemonic known as in the COB. We're having the beta blockers. We're having the organic nitrates. We're having the calcium channel blockers. Yeah. So the mechanism of action of these drugs is that this one blocks the beta receptor ones. This one binds to the nitric receptors. It binds to the what? Nitric receptors, therefore increasing nitric what? Oxide, and reducing what? Vasodilation. While the calcium channel blockers, they are blocking what? The calcium channel in the heart. Therefore reducing what? Vasoconstriction and increasing vasodilation. So those are their mechanisms. Now coming to the drugs they contain beta in the beta blockers, we are having propanolol, timolol, nadolol, and many other drugs. So those ones with low at the end, they fall where? Beta. We're having propanolol, timolol, nadolol, and many more. Coming to the organic phosphates. With the organic phosphates, we are having drugs such as nitroglycerate, isobutyrate, having isobutyrate mononitrate, isobutyrate dinitrate. Yeah, those are the drugs we're having in there. So we are finding that drugs in here, they are increasing supply by causing what? Vasodilation. While reducing by what? Reducing the after and preload. So these drugs are a cornerstone in the treatment of what? Angina. Organic drugs are a cornerstone in the treatment of what? Angina. With the calcium channel blockers, you're having drugs such as nifedipine. We're having drugs such as nicardipine. We're having drugs such as dilitazam, verapamil. Yeah. We have three types of angina: stable, unstable, and variant. Three types of angina, stable, unstable, and variant. So with stable angina, we are finding to say 70% of the heart is blocked. Only 30% is what? Functioning. 30% is the only part which is functioning. And then these ones, they can only have what? Attack. They can have what? Attack at night. No, not that, sorry. These ones, they have what? Narrow. Okay, just like that. It's fine like that. So these ones, they are only having about, they have 90% of the heart being what occupied. The rest, the rest 10% is the only part which is what working. These ones are prone to dying even at night. And then with variant, these ones are having what vasospasms, sudden contractions in the what, in the blood vessel, in the contraction vessels of the heart. So now, in the treatment of variant angina, we can combine two drugs. We can combine calcium drugs and nitrate drugs to treat what? Variant angina. These drugs have side effects. With the side effects, they are more similar. With beta blockers, the effects are that they cause impotence in men. They cause cord extremities, they cause bradycardia, they cause heartbreak, they cause hyperglycemia. Those are the effects of what? Beta blockers. Coming to the organic, they reduce what? They reduce epicardia, reflex tachycardia, hypotension, and bad headache. That's about this one. Bad headache, tachycardia, reduced epicardia, and hypotension. Coming to the calcium, the effect of the calcium is that these ones, they cause edema, reflex tachycardia, just like the organic, constipation, bradycardia, hypertension, and headache. So those are the effects. That's it about angina. Stay blessed.